Mhm. Hi everyone, I'm Jocelyn Castillo, Community Health Specialist at the Yakima Health District. Thank you for watching today's COVID-19 update for Yakima County. Today we are joined by a special guest, Dr. Marty Brueggeman from Virginia Mason Memorial, and he will be providing us with a quick update from the hospital regarding COVID-19 hospitalizations. Thank you, Dr. Brueggeman, for being with us today. We'll,
Absolutely.
we'll be hearing from him shortly. To start, we are at 16,317 cumulative cases of COVID-19. Currently, there are 43 individuals who are hospitalized, 4 of which are intubated. And unfortunately, we have lost additional community members since our last update last week, which has brought the total lives lost due to COVID-19 to 267. So please continue to do your part to stop the spread. We can all take simple steps to fight this virus. Continue to wear your mask, practice physical distancing, avoid social gatherings, and stay home if you are sick. We all have the power to keep ourselves, families, friends, and our community safe. Today, I want to talk about the new quarantine guidelines the Centers for Disease Control and Prevention, or the CDC, released last week. Previously, if you were exposed to COVID-19, it was necessary for you to quarantine for 14 days after the last known exposure and monitor yourself for symptoms during those 14 days. And while the CDC still recommends a quarantine of 14 days, and that is still considered the safest and best option to reduce the spread of the virus, they have released new shorter options in an effort to make quarantine less burdensome and have less of an impact on mental health or a person's ability to return to work. The first option is that quarantine can now end after 10 days as long as you do not develop symptoms within those 10 days. You should still continue to monitor yourself for symptoms for the 14 days, but you can resume normal activities without the need to quarantine after 10 days as long as you remain asymptomatic. The other option is that quarantine can end after 7 days as long as you do not develop symptoms and you receive a negative COVID-19 test 48 hours before the 7th day. Again, you still want to monitor yourself for symptoms for the full 14 days. However, we do encourage those who have been exposed to COVID-19 to quarantine for the 10 days so that individuals with a greater need to get tested, such as those who have symptoms, can continue to have access to testing resources. If at any point you do develop symptoms of COVID-19, you should get tested immediately and stay home while you wait for your results. If you test positive, please separate yourself from others, notify your close contacts, and stay in isolation. The isolation requirements for individuals who test positive for COVID-19 still remains the same. If you test positive and have symptoms, you can come out of isolation after it's been at least 10 days since the symptoms first appeared, and at least 24 hours have passed since your fever resolved without the use of medicine, and if your symptoms have gotten better. If you test positive but have no symptoms, you can be around others after 10 days have passed since the date you had your positive COVID-19 test. And just as a quick and final reminder, free community-based testing is currently available in 2 different locations here in Yakima County. The first location is in Yakima at the Yakima State Fair Park. Testing is available from Saturday to Thursday from 9 a.m. to 3 p.m. Except Thursdays it opens from 12 p.m. to 6 p.m. And then the other site is at the Sunnyside Community Center, and this opens from Sunday to Thursday from 9 a.m. to 3 p.m. However, Tuesdays it only opens from 12 p.m. to 6 p.m. Pre-registration is strongly encouraged for both sites to minimize waiting times while you get tested. You can either pre-register online or call 211 to get registered. And with that, I'm going to turn it over now to Dr. Brueggeman, who's going to provide some information on hospitalizations from Virginia Mason Memorial. Go ahead, Doctor.
All right. Thank you, Jocelyn. Well, it's been about 2 weeks since Thanksgiving, and unfortunately, we're starting to see a big surge in cases. This is actually kind of what we expect after a holiday when groups of people gather unmasked for periods of time. And unlike summer, when a lot of these gatherings took place outdoors, this time of year they tend to take place indoors, which really heightens the risk. And so we're definitely seeing more cases now. Today we hit 30 COVID positive patients at Memorial. This is the highest number we've had since early July. July 9th was the last time we had more at 31. So we're starting to get back to numbers that we haven't seen since earlier this summer. With Christmas just 2 weeks away, it's just absolutely crucial that we all continue to mask and follow the social distancing guidelines, so we don't further spread this and put additional burdens on our healthcare infrastructure. A lot of questions coming about the vaccine. We did get good news. The FDA has now given their endorsement that the vaccine is safe and effective. Having said this, it's going to be quite a while before it's widely available. We have limited doses initially, and they will be scheduled for kind of the frontline workers, ICU nurses, intensive care doctors, ER doctors, people who are coming face to face with this. And then we'll go on to high risk individuals. So we'll probably be late spring or early summer before we really see the opportunity to do widespread vaccinations in the community. In the meantime, we have highly effective methods of controlling it, just with the masking, the physical distancing. So I just encourage everybody to continue to honor those recommendations. Anything else, Jocelyn, that you want me to talk about? I know there were some questions actually about immunity. And so COVID-19, as you know, is a relatively new illness for us. A year ago, none of us really had heard of it, or maybe about a year ago is maybe when we first started to hear about it. So we don't have a lot of experience with it. We do have a lot of experience with other members of the same family, though. So there's other coronavirus out there most notorious for causing the common cold. What we know from those experiences is that typically immunity to those viruses only lasts around 9 months, give or take. And although we don't have enough experience with COVID to know if it'll follow the same pattern, we can certainly, it's certainly a good place to start. And we are seeing case reports of people who are getting a second time around of the infection. Now that enough time's gone by, some of the people that got it early on are getting it again. And so that at least gives us some initial indication that it's probably going to follow a similar pattern. Unfortunately, this means that if you had it early on, it's very likely that you will again be susceptible to it. So it's crucial that even if you've had it, you don't consider yourself immune and you continue to follow the recommendations just as everyone else. So any other questions, Jocelyn? Anything else you want me to try and cover here?
No, thank you, Dr. Brueggeman. I think that was it for today. So as Dr. Brueggeman mentioned, while we wait for a vaccine, it's still important that we continue to follow the current public health guidelines, such as wearing masks, avoiding close contact with others outside our household, staying home if we're sick, and getting tested for COVID-19. That's all we have for today. So as always, you can leave questions or comments in the sections below, in the comment section below. Thank you for watching.